Patient-oriented research in the Canadian context really involves connecting patients and families with researchers and health system people. So originally, for many years, health research was conducted primarily by academic people, by the academic system. In the last number of years, health research has involved the health system itself as well as the universities. But there's a third important component that's missing in all this. This is the patients and families themselves. And so patient-oriented research is our program, our attempt to bring patients and families into making decisions about what's important to research in health and even how to research it, because patients and families do have a lot of knowledge and strengths that we should be taking advantage of, along with our health system people and our academic researchers. Saskatchewan has, in some ways, a similar demographic to this country. 16.3% of our population in the province is indigenous, primarily First Nations and Métis. And so that's actually quite similar to the population of Maori in New Zealand. We're a younger population, and as the indigenous population grows up, will become an even more important part of the workforce. Indigenous wellness indicators are an important concept that really fits with indigenous views of the holistic nature of health. What I'm trying to do in the organization in which I work is trying to bring the strengths of indigenous ways of knowing to mainstream health and wellness, bringing indigenous ways of looking at the world together with the European or Western ways and taking advantage of the strengths of both ways of knowing. It needs to start with dialogue. It needs to start with relationship building. It's not something that has really been part of mainstream culture. I think that mainstream research will really benefit by bringing in the voices of communities. What we're trying to promote is opportunities for communities to tell their stories, not just to the academic people, not just to the health system, but to other communities. Whether we're indigenous or not indigenous academics, we shouldn't be serving as the translators of these stories. We should allow for the communities to present their stories of success, of good practice to other communities directly. I think communities have the strengths and the capabilities to do research themselves, to make those decisions. We do have communities that are strong currently, that have many strengths, and we just need to ensure that they get some opportunities to lead their own research. But there are many other communities that haven't, for historical and socioeconomic conditions, got to that stage of being able to carry out their own research. That's part of our role as a research organization, is to reach out to those communities that need the biggest help upward, the strongest hand to allow them to find their own voice in the world.